It's a unique place because we serve 2 cities and 2 different counties. So it's a great challenge for us to be able to figure out how do we engage all the communities we serve in a way that's authentic to them. Because one of the big challenges every hospital has is mental health patients. We're often not organized that way. We're not staffed to take care of them, and we're waiting for county systems to find placement.
We were being inundated with people who were really in crisis. They would come to us, we would evaluate them, and if they needed to be hospitalized, they would be waiting there for days and days and days on end. But it was not quality care. It was dangerous.
We knew that we needed to do something different. The county director at the time asked me if I'd be willing to embed crisis counselors into the emergency department 24 hours a day, and I said absolutely. And that was on a Friday afternoon. We had met with their administrative team and our administrative team. Monday morning we had the crisis counselors here.
When I started years ago, we had 2 crisis counselors over at mental health. That was it. Since we've been embedded in the ER, we hope to have at least 3 here and 2 at mental health. And we also have mental health workers at crisis looking for hospital beds for the patients that we have here.
One of the barriers that we started out with is learning to speak the same language. Medical terminology is different than psychiatric terminology, and yeah, we got to treat each of them individually.
Currently, we treat every patient like any other person who comes into the emergency department. We have a full team assess them in parallel, treat them with the crisis team, the ED team, and the telepsychiatrist.
We work with telepsychiatry, which is the legal piece of a physician doing a real hour-long assessment to make sure that the patient has really been assessed by a physician for their stability and make sure that it would be safe for them to be discharged back home with their family.
So we created an algorithm that gives us a path to follow from the minute the person enters the door until they leave. It's a dedicated process that we have shared with all the hospital and with all of the PES staff so that everybody knows when we say we're on a Seek Hospital path, we know what we're doing. Everybody knows the path.
It takes the county, it takes the hospital, and it takes telepsychiatry services. It's like a 3-legged stool.
The beauty of our collaborative is it could be replicated throughout the state and maybe modeled throughout the country.
We had a mom tell us that her son had schizophrenia since he was a child. He had been sent to the county facility where he had waited days and days and days out on their lawn or in their small room waiting for bed placement. And at that point, he was in crisis, and she would lose days of her son's life. And she said when she came here, we were so quick. We got treatment, we got telepsychiatry, we got him back on his meds, and she actually was given back days of her son's life.
What I like most is seeing people get the care they need, providing a safe environment for both hospital staff, mental health staff, and definitely the client.
Instead of pointing fingers or trying to assign blame for who should do more, we all took accountability of what we can do together and collaboratively to solve a very difficult social and clinical problem.